Hello, everyone. Thank you for joining us for Critical Conversations About Glaucoma. My name is Hillary Golden, and I am the founder of Glaucoma Coach. I'm also an Aspect Patient Engagement Program graduate and a glaucoma patient advocate. I'll be moderating the webinar today. We will have an open discussion on the questions and issues about glaucoma that don't always come up during our eye appointments. We have two panelists who are joining me now. Dr. Karen Allison and Dr. Pathik Amin. Dr. Allison is an associate professor of clinical ophthalmology at the Flaum Eye Institute at the University of Rochester Medical Center. Dr. Amin is a visiting associate professor of ophthalmology in the glaucoma service at the Illinois Eye and Ear Infirmary at the University of Illinois, Chicago. We'll also have a special appearance later in the session from Jeanetta Price, who's the manager of the Aspect program at Prevent Blindness, and she'll be sharing a poem about glaucoma. We'll have a Q&A after hearing from all the panelists. Please note that the information shared in this webinar is for educational purposes only and is not intended to serve as medical advice or to endorse any specific treatment or product. Always consult your healthcare provider for personalized medical guidance before making any decisions regarding your health or treatment options. We encourage you to reach out to a qualified medical professional who can address your individual needs. Now let's have Dr. Allison and Dr. Amin join us. Thank you for being here today.
Thank you. Thank you for inviting me. Good afternoon, everyone. It's a pleasure to be here today.
Likewise, thank you, Hillary, and the Prevent Blindness team for having us on and putting together this really resourceful webinar.
Thank you both. I appreciate you being here. To set the stage, my first question for you both is, what do you wish more patients understood about glaucoma from the very beginning of their journey? And I'll start with you, Dr. Allison.
Yeah, thank you for that question. So many patients, when they are diagnosed with glaucoma, they have so many questions that they are afraid to ask. And I think one of the most important question is, what is glaucoma? What is glaucoma? How does it differ from a glaucoma suspect? And so I can with glaucoma, it's a disease of the optic nerve, and the pressure, the intraocular pressure, is only one of the risk factors for the disease. So a lot of patients are, I'm not sure exactly what glaucoma is. The second one is, how is it treated? Is it curable? Is it something that is can be cured with laser or surgery or medications? And I think it's just important to understand that. So when you go to your ophthalmologist or your optometrist, to make sure you understand what type of glaucoma you have and is it treatable or not. The third question is, how did I get this disease? So many patients think that there is something that they did that made them get this disease. And what we have to realize is that the majority of patients with glaucoma, we don't even know why they have glaucoma. So to understand the risk factors for the disease, to understand what type of disease you have, whether it's open angle glaucoma or narrow angle glaucoma, is essential. So those are the three main questions that I think patients should ask.
Yeah, those are definitely great questions and questions that I had myself when I was first diagnosed. What about you, Dr. Amin? What are your thoughts on what you wish glaucoma patients knew from the very beginning?
Yeah, it's a great question. I think if I could deliver a parcel of sort of knowledge to each of the glaucoma patients, I think it would consist of understanding that, glaucoma is most commonly a painless, symptomless disease. It is asymptomatic, so without symptoms, because it's often a very slow process, and our brain does a remarkable job of adapting to that slow change. In the setting where patients are symptomatic, treatment is not really aimed to improve symptoms. We can't reverse the sort of damage or loss of visual function. It's really in place to help prevent further loss or slow down the progression of glaucoma. The second is this concept of eye pressure. and what is normal pressure. So normal eye pressure is any pressure between 10 and 21. And if you don't have glaucoma, any pressure within that range is normal. 19 isn't better than 11. Often patients that develop glaucoma tend to have higher than normal pressure, so above 21. But there's a whole subset of patients that have normal pressure and still develop glaucoma. Blood pressure and eye pressure are not related. So you can have one without the other. However, in patients that have normal eye pressure and develop glaucoma, so we call that normal tension glaucoma, we do think there is a connection between the blood pressure and the eye pressure, which determines the blood flow to the eye. And so the last sort of concept would be this sort of risk of going blind, right? Glaucoma is this scary term, and we equate it with this end stage sort of blindness that can happen. However, the risk of blindness is highly variable based on the type of glaucoma you have, the age of during which you were diagnosed, the severity of the glaucoma during your diagnosis, how adherent you are to your visits and treatments, and we're very careful to look for patients that tend to change at a faster rate. We call them fast progressors. And so even if you have, even if you're adherent and your pressures are quote unquote at target, you may still change fast. And so this is why frequent testing is done when you go to your visits. There's multiple images of your eyes taken, there's multiple visual fields because we want to identify patients that might change at a faster rate.
Thanks for that information. And as you touched on, compliance is huge for glaucoma patients to help us from losing more of our sight. As we, discuss what initial treatments are, a lot of patients will get started with maybe a laser treatment or with eye drops. What How do you instruct patients on instilling their eye drops, and how do you teach them to do that for patients that have never used eye drops before, Dr. Amin?
Yeah, great question. I think first we should establish that lowering eye pressure is really the only modifiable risk factor we have. Potentially in patients that have normal tension glaucoma, blood pressure might be something we want to look at as well. But eye pressure is something we want to target. And so it is key to lowering it is key to slowing down disease progression. And laser SLT is now first line therapy, but in individuals that don't respond well to that or want to try drops first, it is essential that we get those drops in regularly. And sort of three areas that patients struggle with drops are adherence, installation, and potentially access to these drops. So for adherence, I advise my patients to associate this new drop with an already established routine. So whether you brush or floss at night, or you have other oral medications you've been taking for years, it's less successful to create a new sort of routine. So associating with something you already do can be helpful. The second is leverage sort of resources. There are multiple drop reminder apps on the App Store. There are also drop schedules or calendars you can sort of print out and put on your refrigerator. The Glaucoma Community app, which is created by Prevent Blindness, has a option to download a drop scheduler that you can print out and kind of fill out. In terms of drop installation, I think the sort of approach you take matters. I often suggest that patients sort of tilt their head back, pull down the lower eyelid and put a drop into that cul-de-sac that's formed there. And that tends to work well. And if you're unsure whether the drops are getting in, ask a family member to verify for you. You can ask the doctor in office to demonstrate or watch you instill the drop. Additionally, if you refrigerate the drops, they can provide some tactile confirmation that yes, indeed, the drop has gotten into the eye. Uh, Folks that have issues with running out of refills too soon, ensure you're not wasting your drops. Again, you can ask someone to observe to make sure you are indeed getting the drop into your eye. There are drop squeezer aids that can help you squeeze the smaller bottles. Notoriously, latanoprost comes in a really tiny bottle, and it's really difficult for patients to get the drop out. So potentially a squeezer aid can help prevent, additional drops from being dispensed. There are also other sort of devices like the nano dropper, which can help extend the sort of use of your bottle and You should talk to your doctor whether that may or may not be appropriate for you to use. Um, and if you do run out and it's not the norm, or if you're going on vacation and you're going to miss a refill, talk to your pharmacist. They can be excellent resources in terms of working with your insurance to get additional refills for you.
Yeah, those are
Um,
great tips. Thank you. And Dr. Allison, many patients struggle to explain what's happening with their vision when they're losing some of it. How best can patients describe to you their symptoms so you can help understand what they're experiencing?
Yeah. Great question. So with glaucoma, usually the visual field loss or the loss in your part of your vision starts peripherally and then it comes into the center. So because the way the brain works, a lot of times you don't even notice it until it's too late. So by the time you start noticing that there's a change in your vision, it's already advanced. So that is the reason why when you go to the doctor, they do the visual field once or twice a year just to see if there's any visual field loss. And a lot of times it comes in from the side, and then the patient may notice that their field of vision is decreasing, or they cannot see above or below. That there's like darkness below in their field of vision, and that's one of the big challenges with a lot of patients that they especially if the glaucoma is not symmetric, meaning that it's not the same in both eyes, they may notice that one eye is darker than the other. So the way to explain that is really to say how it affects your life, how maybe going down the stairs, or maybe you need more light to see, or you're having difficulty reading because um, your depth perception, or you're able to see the depth of something is impeded because one eye is working more than the other eye. So these are some of the ways that you could explain to a doctor. Maybe lifting up something, it's harder to lift it up because you don't notice because you what we call depth perception. So usually, one of the things that I recommend that for patients to do is to close one eye and then see what if they can see their fingers from all sides. Close the
Mhm.
other eye, and sometimes they can notice if there's a field defect, because sometimes when both eyes are working, it's very difficult to pick that up. And so that you can tell your doctor you're having difficulty going down the stairs, you're having difficulty walking at nights, you're having difficulty picking things up or cooking or cutting something because you're afraid that you may cut yourself. So these are some of the things that you can mention to the doctor to help them understand how severely affected or the progression of your disease causing field defects.
Yeah, that's such an important point because our brain is filling in these details, so we don't realize that we're losing sight as rapidly as we are, which is why they call glaucoma the silent thief of sight. Um, Dr. Amin, what are the most common daily challenges that patients bring up related to daily tasks, quality of life, and independence that that you hear from them, and how do you respond?
Yeah, so when talking about vision impairment and glaucoma, I think it's important to sort of stress that most patients with primary opening glaucoma, if they're caught early and treated, will not experience, significant vision impairment and will maintain a good quality of life. However, there are fast progressors, or patients that already have advanced glaucoma at the time of diagnosis. They can have, significant impacts to visual function, mobility, independence, and all of that can kind of play into emotional well-being. There have been a lot of studies that look at quality of life, and they found that, as Dr. Allison talked about, peripheral vision can be compromised. Losing the bottom part of your vision can really have a bigger impact on quality of life as it relates to mobility. Independence and driving are often strongly linked, and in studies that evaluate, glaucoma's impact on driving, um, when driving with a trained instructor, glaucoma patients in various studies were more likely to need the instructor to apply a brake or have more variability in lane positioning, had poor anticipatory skills, and that was even with milder stages of glaucoma. Tasks such as reaching and grasping an object and then transporting it to another location is a very important activity of daily living. It's something we do subconsciously. But in patients that have central vision loss, which we now know can occur early in glaucoma as well, have difficulty with those tasks. And patients that have central vision loss can have impacts to speeding, reading speed and accuracy.
Wow. So, Dr. Allison, as we've touched on, with this visual loss and with this uncertainty and losing potentially, some being able to drive and things like that, glaucoma brings fear, anxiety, and uncertainty. So, what advice do you give to patients and their partners who care for them when they're feeling overwhelmed and worried about their diagnosis and their future with this disease?
Yeah, so the first thing is when someone is diagnosed with glaucoma is to really speak to your doctor to see what stage you are. So is it early, is it middle, is it late stage, and what type of glaucoma? And also, when you are prescribed medications, don't think that they're just drops. They're really medications that will decrease the pressure in your eye. And as Dr. Amin said, the intraocular pressure is the only modifiable risk factor. So not that the intraocular pressure is what caused the glaucoma, it's just one of the risk factors towards glaucoma. And unfortunately, that's the only one that we can really treat. So it's important to make sure that you take your medications and be as compliant as you possibly can. And of course, if the medications aren't working, there's other options. There's lasers, there's surgery. But in most cases, most patients are started on some form of medication. The other thing is to understand that the disease is very slowly progressive in most cases. Yes, they're fast progressors, but in the majority of patients, it's a slowly progressive disease. And if you make sure that you keep your appointments to make sure that to see whether the visual field is changing or the pictures that they take or the optic nerve is changing, that will also help the doctor to guide how to aggressively treat your disease or whether you're stable or not. The third thing is you have to realize that because glaucoma affects the field of vision, it can affect the way some of our daily activities, such as driving, such as reading, such as going downstairs. So these are all things that can occur. And sometimes this can make us feel very, very um, depressed or very anxious. But what we have to realize that there's help out there to help us when we get to that point. There's occupational therapy, there's visual rehabilitation, there is behavioral therapy, and also with the Prevent Blindness website, there's so much support system that's there to help us or help patients that have this severe disease. There's exercise that we can do, not necessarily to cure the glaucoma, but to make sure that adequate blood flow is going towards the optic nerve. Because we know that if the optic nerve is not getting enough blood flow, that can also cause the glaucoma to progress. So exercising, moderate yoga without inverting positions of the head, eating correctly, green leafy vegetables, and making sure that we have just moderate exercise, good diet, and of course, reach out to your family and friends as a good support system to make sure that they understand what you're going through so that you don't feel alone. And sometimes, if you have no family close by, you can also reach out to your doctor and they can help to provide support system for you. And you can realize that you don't have to go blind with glaucoma. A lot of people live with glaucoma, live healthy, productive lives, still working, and it's not the end of the world for you. Just realize that you can live a full life glaucoma is a very slowly progressive disease. A lot of people do not go blind, only a few does, and those we can help to support.
I think those are great tips, and it's so important for patients not to lose hope and to, like you said, reach out to family, reach out to their doctor if they're having problems. And there are things we can do as patients to take care of ourselves, like eating and exercising, as you mentioned. Um, Dr. Amin, many patients, we know that glaucoma, a huge risk factor is if you're someone in your family has glaucoma. What's the best way that you found for patients to be able to talk to their loved ones and family members about the hereditary risk from, them being diagnosed with glaucoma and the importance of eye exams and make sure that they get those eye exams because we really, really want them to.
Yeah, excellent question. As we've sort of reiterated on this webinar, glaucoma is a painless, symptomless disease, and often patients are diagnosed at a point where you're being told you have glaucoma, but you're not even aware of it, right? So, how do we identify patients that have glaucoma? Because, yeah, we can catch glaucoma early, prognosis is great. We can't screen everyone, that's not practical or cost effective. But we do have the unique ability for our patients and empower them to educate family members, specifically siblings or kids, on their risk and the importance of getting screened. For family members who don't know they're at risk, early detection is everything. And, there's genetic studies that suggest that nearly 50% of glaucoma is familial. There's very strong hereditary, especially among siblings. And the rate of glaucoma can be, 10 times higher amongst individuals who have a sibling with glaucoma. And there's a lot of studies that kind of back that up. Um, One study in Philadelphia found that those with a family history of glaucoma had a 3.5 time, were 3.5 times more likely to have glaucoma compared to people that didn't have a family history. And that was even higher if you had a sibling with glaucoma. There was another study done in the Caribbean where they followed patients with glaucoma over 8 to 10 years, and they found that, and they also sort of monitored their relatives, and they found that about a quarter of the relatives um, eventually developed glaucoma. There's another study in the Netherlands that found that having a family member with glaucoma increases your risk by ninefold. And so all of this sort of data shows that family history matters. And so, as a patient, if you're able to talk to your family members, siblings, and kids about getting screened, potentially, sharing whatever you're comfortable with in terms of your journey with glaucoma, that can really help, direct them to get a screening done. And I think it's also important to emphasize that even though a family member may not have glaucoma at the time of screening, the risk is still there as they get older. The primary form of glaucoma typically manifests in the fifth or sixth decade of life, and so they should get continued to get screened on a more routine basis.
Thank you for that. Screening is really important, and getting that eye exam is essential for, especially for family members with those of glaucoma. Dr. Allison, what lifestyle habits make the biggest difference in long-term glaucoma management? And what do you tell patients when they ask, should they sleep more sitting up or at an incline? What are your thoughts on that? And do you think that there's things they can do to help keep their eyes from progressing?
Yes, definitely. So, we talked about diet before and exercise. The other thing is good sleep habits. It would be ideal to get 8 hours of sleep and sleep with your head slightly elevated so that it's not flat. The main thing that happens at night is that your blood pressure gets really low, what we call nocturnal hypotension. And with that, it decreases the amount of blood flow going to the optic nerve. And you see that especially in patients with low tension glaucoma. So, patients that take blood pressure medications, especially the beta blocker medications, sometimes, a lot of times, the medical doctor will tell you to take that during the day and not at night. And the reason because for that is because at night it may cause the blood pressure to go too low, which causes not only damage to the optic nerve but also to the brain. So the other thing is to make sure that when you go to your doctor, to make sure that you write down what your pressures are. It's important to keep a track of what you're, because you have to make sure that you're engaged in your care. So being engaged in your care means knowing that what your blood, your eye pressures are, knowing what your blood pressure is, and what your blood sugar is, because these are all related to your glaucoma. The other thing is to make sure that you keep up with your testing. So you get your visual field at least once a year, you get your OCT at least once a year. And then you have a critical conversation with your doctor to know where you are. Am I progressing? Am I getting worse? Am I stable? And make sure you take your medications. These are medications, they're drops, but they're medications, and they're essential in order to decrease the pressure. Some people may be on one medication, some people may be on four medications, but each medication works differently and works together to decrease the intraocular pressure. The other thing I wanted to mention is that there's so many risk factors for glaucoma. One is race and ethnicity, is a high proponent of glaucoma. Family history is another one, history of trauma, history of diabetes, history of hypertension. And as you get older, people over 60 have a higher rate of glaucoma than for some race over 40, but in general it's over 60. So these are the times when you should really make sure that you get your eyes examined. Now, it's okay to get your intraocular pressure done, but as Dr. Amin said, your pressure could be completely normal and you still have glaucoma. So it's good to get not only your intraocular pressure, but also get a dilated exam so that it can look at your optic nerve. And if the optic nerve is abnormal, make sure you get a visual field test done so you can see, is there any damage to my visual field, or OCT to look at the optic nerve. The glaucoma is a disease of the optic nerve. The pressure is just one of the risk factors. Um, the other thing I should say is anything that's good for your heart, meaning exercise, the diet, is also good for your eyes, because the blood flow that goes from the heart goes to the eyes, goes to the brain. So those are the only things I can think of right now. But being involved in support groups, being involved with your family, reading about your disease, and being engaged is important in keeping track of your disease.
Thank you, Dr. Allison. And you reminded me of when I was diagnosed. I went to an OD for a sty, and they dilated my eyes. And the first thing she said when she looked in my eye was, "I don't like the look of your nerve." And at the time, I didn't know what she meant by that, but that was how I was diagnosed. And I had been having eye exams every year. So, because my pressure's low and I have normal tension glaucoma, it was harder for them to find it.
Mhm.
And these are things, just like you said, the optic nerve is the key, right? And the minute we start seeing changes there is where we have those red flags that start to come up, and we want to look a little further and get the tests like you were mentioning. Um, for our last question, we're going to talk about 3 questions that you think every glaucoma patient should feel empowered to ask. And I'm going to start with Dr. Amin. So, knowing what you know about glaucoma and your experience with patients, what do you always wish they would ask you, or what do you feel like they shouldn't be scared to ask when they go in for their appointment?
Yeah, Hillary, thank you for that question. I think the first is my glaucoma stable? As a patient, you're probably going in for anywhere between 2 to 4 visits a year, depending on your stability or severity of glaucoma. And your doctor is able to then use those visits to determine whether your eye pressure is at a level that's stabilizing your glaucoma, or you're at a low rate of progression. And so you should ask that question to your doctor. I think that can help reinforce that, hey, yes, I'm using these drops, I'm coming to my visits, and it's impacting the sort of status of my glaucoma. I also think patients, have, again, as we've talked about, this sort of anxiety of glaucoma and blindness. And so I think having a frank discussion about your risk of going blind is important. So what is my prognosis as an individual based on my type of glaucoma and severity? The second question is, what other treatments are available? Do I have to take multiple drops every day for the rest of my life? and communicate within that conversation. I'm having, if you're experiencing side effects that you are uncomfortable with, whether that's how your eyes feel, how they look. There are options that are for preservative-free options. There are options that are non-medical in terms of a laser or other sort of glaucoma treatments that are available. But if you sort of state that, yes, I'm doing great with my drops, then your doctor may not have a further conversation about some of those options. And the last is, I think, communicating sort of any sort of symptoms that you might be having, any sort of tasks that you might be struggling with, even if you're not 100% sure it's due to your glaucoma. I think informing your provider and having a honest conversation about um, day-to-day sort of activities that you might feel like your glaucoma is impacting can then help us direct you to the right resource, right? And that can be in the form of a low vision specialist who can kind of work with this sort of multidisciplinary team along with a behavioral so therapist, occupational therapist, as Dr. Allison mentioned, to kind of help sort of combat those sort of concerns you have about quality of life.
Great. And what about you, Dr. Allison? What do you think patients should feel empowered to ask when they come in for their appointments, and that will help them better understand glaucoma and their disease in general?
Yeah. So I agree with everything Dr. Min says. But in addition to that, ask what the alternatives are. What are the alternative treatments? And if you're on a drop that doesn't maybe burn in or you have a reaction to, find out if there's another drop that you could take. Be open to that because the more you're engaged in your treatment, the better it is for you. Find out what your intraocular pressures are. Keep a log of it, just like you keep a log of your blood sugar and your blood pressure. Keep a log of your intraocular pressure, and then you'll know where you are. You know if you're a target. You know if you are controlled. And then the other thing is find out if a lot of patients say, "Do I have to take my medications every day?" So, that opens a frank conversation with the physician or with the doctor about the goals of treatment, what type of glaucoma you have, and so that will open that conversation. The other question that I'd recommend is what type of glaucoma do I have? So is it open angle glaucoma? Is it narrow angle glaucoma? Is it a special type of open angle glaucoma? Is it low tension glaucoma? Because when you know what type of glaucoma you have, then you're better able to understand what your target pressure should be and what some symptomology is. And from that, you can also find out is the glaucoma stable or is it not stable. The other one is what are my risk of the disease progressing? What are the risk of me losing my vision or the disease progressing? Where in this disease process am I? And I think it's important to understand that because that will help you with some to understand um, what some of the what you may need in the future. So if your disease is very early, very slow, you may just take your medication, do laser, and you'll be fine. If it's very aggressive, very advanced, you may start thinking about other things. What's my chance of losing my vision? And do I have the support system or the support to help me in that way? So be more proactive and be engaged with your doctor in understanding your disease and keeping a log. It's always good to keep a log of where you are so that you will remember. And don't look at it as something to be scared of, but something to be involved with, just like any other chronic disease, so that you'll be completely involved in your care.
I think that's a great point because it is a chronic disease, so it's something that we will have for the rest of our lives. So, we really need to partner with our doctor because we're both in it for the long haul. And just one more question. What are some tips, and I'll start with you, Dr. Amin, that you can share for patients who've lost sight from glaucoma to help them maintain their health and independence? Because I mean, that's the biggest fear here among patients is like, is what do I do when I've lost sight? And what do you tell patients in those situations?
Yeah, I think that kind of circles back to one of the questions that I think I urge patients to ask, glaucoma patients to ask, which is, communicating about what day-to-day activities you might or symptoms you might be experiencing. Low vision consultations aren't really a standard sort of practice. So just because you have glaucoma doesn't mean you automatically referred to a low vision specialist. But if we know you are struggling with something, we can kind of make that referral. In large sort of medical centers, you typically have in-house low vision specialists or clinics that they can refer you to. When you see a low vision specialist, I think it depends on the type of vision loss you have, right? So if you have central vision loss, kind of in the middle of your vision, as we've talked about, this can lead to reading difficulties, impaired facial recognition. This can impact social interactions. And so in these sort of situations, your low vision specialist may work with you on eccentric viewing training, where you utilize other parts of your vision apart from just straight ahead. Um, the most common type of vision loss, though, is loss of your peripheral vision, and this then impacts mobility, increases your fall risks. Specifically, is more problematic in unfamiliar environments, a grocery store, you're visiting someone's sort of space, and this is because you have less spatial awareness. And so, in this sort of setting, your low vision specialist may work with an occupational therapist or another team member to help provide training in orientation and mobility training. And so, most commonly, it's not just a visit to the low vision specialist to get a magnifier or a telescope. Those are optical devices that they can prescribe you. There's also environmental modifications that they can talk to you about. This could be optimizing the lighting in your home, increasing contrast, uh, reducing glare, maybe installing tactile markers to improve safety and functionality in your home. I think having that conversation to get a low vision sort of evaluation is important because there's a lot of resources that are available, especially with the advancement of technology, that can help restore some of the function that might be lost from glaucoma.
That's great for
Yeah.
patients to know that there's options, that it's not that they can go even to learn to look at a different part of their vision. That's something I wasn't aware of. So that's amazing that we can teach patients how to do that. Dr. Allison, would you add anything onto that?
Yeah, so I agree with everything that Dr. Min says, but the other thing is to have some behavioral therapy or maybe some psychological therapy because people get very depressed when they
Hmm.
start losing their independence and their functionality. And I think that's something that we really need to look at, not only in the patient but also in the family. We need to make sure that they have financial security because a lot of times they may lose their jobs, they may lose an income coming in. Also, make sure that they have enough help to go to the doctors, maybe social services to give them some help and um, both financial and emotional support. And of course, low vision is key. And I think we have to make sure that when we give a low vision referral, we also do a behavioral health referral, a psychological health referral, not only for the patient, but for the family and social services so that they make sure that their financial support is intact.
Those are things that you don't always think about, but that the mental health of patients is so important, and then the financial aspect as well, because like you said, there could be some limitations to jobs, and there maybe they have to switch to a different type of job, but at least being keeping these things top of mind is really important. So adding on to this, we're gonna go over some resources that Prevent Blindness has for patients. And I'm going to start sharing the screen here. And the glaucoma community, I think Dr. Allison touched on this earlier, but it's a free online or app-based community that empowers people living with glaucoma through knowledge, support, and shared experiences. So you get a customized news feed, so you can kind of pick and choose what areas you want to see more about, or if you have a whatever your particular type of glaucoma is, it'll send you information on that. So there's a lot of information about glaucoma and a community page where you can connect with others in addition to more resources just in that glaucoma community. I will let you guys know that if you do have your cell phone out and you can scan that little QR code in the bottom left, it will bring you to that page. And we're going to go over a few more resources. They'll all have that QR code. If you guys missed the QR code for some reason, this webinar is being recorded, so we'll post it after the webinar is over, and you can always scan it after the fact as well. But that is our first resource, that glaucoma community. And then the next resource we have is how to put drops in your eyes. This is so important. Dr. Amin touched on this earlier of the steps to take to get the drops in your eye. Some patients need a caregiver to help them with putting the drops in. Some patients are adept at putting the drops in themselves. But again, you can scan the QR code. There are downloads you can print out, and there's also a video guide. So you can use that to watch and see live how to put in the drops, or you can just print these out and use this as your guide as well. And then the next resource is the glaucoma financial assistance information. This is amazing because it's going to give you resources to patient assistance programs for eye exams, vision care, treatments, and it'll also include prescription savings and other resources for patients. Again, you can scan this QR code and find out more about the financial assistance programs that are offered. And then I'll talk about the Aspect Patient Engagement Program. This is one of my favorite things that Prevent Blindness offers. It is a signature program that aims to equip individuals who live with vision loss and blindness, as well as their allies, whether that's a caregiver or a family member. And it gives patients and caregivers knowledge, skills, and confidence to become advocates for low vision and for eye health in general. And you can use this at an individual, a state, a local, or a federal legislative level, because all the participants learn to share their own story of their vision journey. And you meet other patients who have a vision disease or disorder or their caregiver. And you learn to use your stories to improve vision and eye health, policies, and research. And I was a graduate of this program, and it's just so well run, and it teaches you so much. And when you get out of it, you really do feel empowered as a patient, and you are able to share your story. You're with other patients who know exactly what you're going through and what your challenges are. And I just can't say enough good things about my experience with the program, and encourage you to contact Prevent Blindness to see when the next cohort is for the Aspect program and see how you can join if you're interested. The last resource I have here is Living Well with Low Vision. So Dr. Amin and Dr. Allison both touched on this, that the goal is to make it as easy as possible for people to educate themselves about vision loss and how to deal with the daily challenges that come from it. So this has resources, guides, support groups. It even has a transportation service finder, which is amazing, and a clinical trial finder. So for those patients who are interested in finding out more about clinical trials that they might be eligible for, this is a key resource for them. And again, you can scan this with your phone and use that QR code to get more information and learn about the low vision resources that are provided. And now I would like to invite Miss Jeanetta Price to share a poem she has written about glaucoma. And I would like to welcome Jeanetta to come on screen with us to give us her poem. Let's see if Jeanetta is ready. We might have a little delay. So what we'll do first is we'll get started with some questions, and then when Jeanetta is ready, we'll come back and do the poem. So I have some questions ready. Dr. Amin, if you can help me out with some of these. So the first question from a patient is, do you get glaucoma after cataract surgery?
It's a great question, a question I get asked regularly. It's often in the context of I know someone that had cataract surgery done, and now they have vision loss or glaucoma. So cataract surgery itself does not cause glaucoma in any way. Now, if the cataract surgery is normal, and cataract surgery is the most routine eye procedure done at this point, if there are complications from cataract surgery that can potentially increase your risk of developing glaucoma or cause a secondary form of glaucoma, but a routine normal cataract surgery does not cause glaucoma.
Okay, well, that's good to know. And let's stay on that subject. So when you do, when you have cataract surgery, what if you have glaucoma and you're diagnosed beforehand? Then would you say that's a ideal time to get a glaucoma surgery in addition to getting your cataract surgery?
Yeah, so we live in a day and age where there's a lot of advances in procedural glaucoma. And so there's a subset of procedures called MIGS, which are minimally invasive glaucoma surgeries. A lot of them are FDA approved, and really the hallmark of MIGS procedures are that their safety profile is very good, and they have sort of modest pressure lowering sort of abilities. And so any of our patients that have open angle glaucoma that might qualify and are undergoing cataract surgery, we do recommend that they talk to the surgeon about a mixed procedure at the same time. And these can have excellent results, can help potentially reduce the medication drop burden for the patient, and is again something that you should talk to your surgeon about.
Okay, great to know. And the MIGS procedures, I know that it's done a lot in combination with cataract surgery, and it's a great that we have that option for patients. Um, Dr. Allison, I wanted to ask about patients asking about preservative-free drops. And with preservatives, we know that the BAK can cause irritation to the surface of the eye. What When do you think that preservative-free options they want to become the standard of care? And you're on mute right now.
Yeah,
There we go.
yeah. I wish all my patients could get preservative-free medications. However, a lot of pharmacists and insurance companies will not approve it, so that a lot of pharmacists, um, the cost is astronomical for a lot of patients. So I think so for most patients, they have to start with medications that has preservative first before the insurance will approve it. When will that become standard of care, preservative free? I'm not sure because a lot of it has to do with cost. And
Yeah.
if your insurance can cover it, that'll be better for you. Less toxicity on the cornea and on the conjunctiva of the eye. However, as I said, most insurances would require you to use at least two medications that has preservatives first before they go to the non-preservative medications.
Okay. Yeah, that's good to know. And I wish we could all get preservative-free drops, but like you said, there is a cost involved with that. Staying in that vein, how long is there a certain point that eye drops no longer are effective for patients? What do you think of that, Dr. Amin?
Yeah, so I think drops are probably a mainstay of treatment for most patients. Now, I think there's good studies that show that SLT can be a first-line therapy, and some patients may not need anything more than that, or maybe in conjunction with the glaucoma procedure, they don't need, patients may not need as many drops. But I think for most patients, they will have to be on some form of drop for the duration of their glaucoma treatment. Um, what do you think, Dr. Allison?
Yeah, so I agree. However, doing laser or surgery does negate drops. So I think for most patients, I always tell them that they doing laser SLT is like adding a drop. So the pressure drop could be between 3 to 10 points, dependent. If it's early glaucoma and the eye is naive to medication, the response is much better. But I use laser in up to my late stage glaucoma, depending on the scenario. And your doctor would have to look at the treatment regimen that they're doing, and then decide when to do the laser. But SLT can be used as a first line treatment. However, you may still need to be on some form of medication. So I think it's good to get used to the fact that medication is still the mainstay of glaucoma care. Yes, we can do cataract, we can do MIGS, we can do other types of surgery, but these are just treatments and not cure. And all of these treatments can last for a couple of years, maybe some maybe months, um, some longer than others, depending on the the state of the eye. And so I think we all should get used to using drops.
Okay. And for a patient has a question about they have thin corneas, and are there special considerations or treatment options they should be aware of, knowing that they have thin corneas and they have glaucoma?
So I think the thinner the cornea, the greater the risk of glaucoma. So that's just something that you should keep in mind. However, the treatment itself does not differ. So, in fact, you really want to get your pressures lower than normal because, depending on how thin the cornea is, that a pressure of 15 may be too high. So, with thin corneas, you want to get the pressure even lower than normal. And that is also another risk factor for glaucoma, in addition to intraocular pressure, in addition to race and ethnicity, family history, diabetes, hypertension. So that's also a major risk factor for glaucoma. So the thinner the cornea, the lower you want to get the intraocular pressure. But the treatment is not, there's no different treatment for that.
Okay. Well, good to know. I think we have Jeanetta
Yes.
back, and she is going to give us her poem, and then we'll get back to the Q&A. But Jeanetta is one of my favorite people, and she's just got such a great energy. And I would love to turn the floor over to Jeanetta to share her poem with us.
Okay, mic check. Can you hear me, Hillary?
Yes, I can hear you.
Awesome. Well, can I be honest? I can no longer live with glaucoma. Maybe I'm the only one that did not see glaucoma was moving in on me. Maybe I'm the only one that could not pay my rent to pay for my eye drops. Eventually, I dropped the eye drops and I picked up the alcohol. I didn't want to live, y'all. Maybe I'm the only one glaucoma destroyed my life by knocking my lights off, lost my job, lights off, lost my license to drive, lights off, crashed and mentally lost my mind, but everyone worried about saving my eyes, lights off. Left me in a dark room, assuming the unalive position, and I can no longer live with this condition. In the words of Beyonce, I woke up like this. But I say, hold on, allow me to take a shot to this. No warning signs, shot. Countless eye procedures, shot. Unbearable eye pain, shot after shot after shot. This is your last shot, glaucoma. One of us must go. My finger on the trigger, ready to release and take back my vision from the sight thief. Yes, glaucoma can steal eyes, but not our lives. I will not stand for it. Today, we're fine shots back by taking back our life, taking back control of our eye story. It's not over, but we can start over. Today is a new beginning. Today is about what I can do. I can share my eye story, not only to save eyes, but to save lives. I can advocate, educate, and motivate society to know that I can, you can, and we can together fight for all our stories matter. I now understand that I am on a mission and advocacy is my new addiction. I'm passing shots of hope everywhere I go. Maybe I'm the only one. That story reached one person who gave up the strength to come back and live their best life out of sight. Maybe I'm the only one. Mm-mm. No, no, no. I am the one that turned the lights on where darkness once lived. Trust me, I see you. It's time for the world to see that blindness does not define abilities. Every platform I share, I am going to continue to speak life and serve light because I can. And you can. We can together save eyes like mine. I can make a difference one eye story at a time. And so can you. With that being said, I need you to unmute yourself and repeat after me. I can.
I can.
You can.
You can.
We can
We
We
can
can
prevent blindness.
prevent
prevent
blindness.
blindness.
And always remember that the price is always right to save sight.
Thank you, Jeanetta. Jeanetta is such a powerful speaker and writer, and online is one thing, and seeing her in person is a whole different level. So thank you so much for joining us, Jeanetta. I really appreciate it, and thank you for your time.
I want to say thank you guys for allowing me to share as a person with glaucoma, and also a licensed professional counselor. I want to say you guys touch on everything, and I appreciate what you guys have done today. Thank you.
Thank you, Jeanetta. And I just want to ask one last question to Dr. Amin and Dr. Allison, and thank you both so much for being here. But patients are asking what they can do as far as is there any supplements or vitamins, and they're also wondering if using computer screens or if outside light can interfere with their eyes. And Dr. Amin, I'll let you give us a quick answer for that, and then Dr. Allison.
Yeah, so screen time or using, reading a lot, television, those things can cause eye strain and fatigue, but do not impact your progression of glaucoma or you developing glaucoma or any really eye disease. So those are two separate things. A very good question. Dr. Allison, what are your thoughts on eye supplements and vitamins for glaucoma?
Yeah, so as I said before, anything that's good for the heart is good for the eye. I think Ocuvite is good. I think anything with lutein or green leafy vegetables or um, ginkgo, anything like that, that is good to increase blood flow, is good for the eyes. Now, I'm not saying there's no studies to show that these are used to treat glaucoma. It's just used to treat the eyes, to give it healthy eyes. It's not like a macular degeneration where we know that these medications work. These are just tips just for a healthy eye. And with glaucoma, you want to get a healthy eye because you do get other diseases. You get glaucoma, you also get cataract, you also get diabetic retinopathy. So these are just things to get a good, healthy eyes. Use artificial tears for the tear film when you take your drops. Wear sunglasses when you go outside. It doesn't have to be very dark, but just to really protect your eyes from cataracts and from the glare. And also with computer, decrease your computer use. Change the screen so it's not completely white against your eyes, maybe a darker color in the background so that less eye strain. So these are just things for the eyes, but as Dr. Min said, it's not going to help the glaucoma per se. It's just going to help the general health of the eye.
Thank you both so much. I appreciate both your very thoughtful answers to the questions, and I appreciate you being on with us today. So, Dr. Amin, Dr. Allison, thank you so much for joining, and thank you everyone who has joined. Thank you all so much.